Kajingilang jaga Kynhun Menteri ke Sarkar Jela ke Balalong haka arpsau terik urampang arhajar arpun Rio. Kala Jingmynjur ke Indian Institute of Public Health Shillong IIPHS Bill arhajar arpun Rio. Kini kesenjam kelong ban Kyntiew kini ke Shlem Pulish ke Kyrdan State University ke Balong kejing kerkui kerensan wat benia bagajing syakri ke koi kakya haka tan chitai lamingi berakobai. Habakran ni gilat patai kubor Menteri ketenat ke koi kakya ba wailat miki shila Ulito bakane karai kalapun ko bor ke IIPHS bakan nak ban I degree segisamla pule bat kinong wat benia hakathan. Ka IIPHS kan trekam hidala dia bat kan long kumunong selok ya ke sarkar hakikam ke bedai bak jing syakta ki klam dan ni jing pang ki bakekan san. Menteri ketenat ka koi kakya ulapun pau bak jela ke dan kam ki riu shampang haka epidemiology bat ki wei kam wat benia alor jing pang. Kam tamadian ke jengkla no Dr. Ricky Jason Kon. Nalor kakam kebedai bakakot kakya ka Kynhun Menteri ke Shimru ikirai ke bakentup ya ke jeng penjela ne ke jeng IY ne ke lease agreement hadu lai posnam ya ke restaurant ke badan harat nongkle asora. Kani ke kentup ru ya ke jeng penbiang temai ke rukom sio YY halor ke rukom trekam public private partnership. Ke Kynhun Menteri ke larai ru ban Jingmynjur dan ke NOC ban penbha ban peniat ban sumar ke eco resort anong klau ke bakentup ru ya ke jing penhe ke yeng basa ban jakabam ke bakambha ke wepat karai kelong ban Kyntiew kyrdan ni ginong tre Anganwadi bat ke Kynhun Menteri ke Jingmynjur ya ke Meghalaya state policy ban Kyntiew kyrdan ni ginong tre Anganwadi ke babit ban long ki supervisor.
As you know that public health has become very important in today's time, especially with the recent incidents which happened, especially to the unfortunate incident which happened to our late MP, Dr. Ricky Sunkon. So we thought that it is very important, and at the same time, this institute is focused on research. So it is very important to have people who do research, especially in terms of epidemiology and other disease and all. So that's why the government has approved that to make this Indian Institute of Public Health as a state university.
So by granting the status of university, the university can actually, basically the IIPH can actually give the degrees to the public health, graduates and scholars. At the same time, it will be in fact, this will be a kind of a important institution for the whole Northeast, because it can really build the public health cadre that is required for not only for the state, for the whole Northeastern region. That's the capacity that it has. And second thing is that, in fact, so far we have got in Gandhinagar, one Indian Institute of Public Health, Gandhinagar. It has a university status certification, and we are actually, again, we are in the entire Northeastern region, we are actually providing that one, because this was actually, as you rightly said, it has been working very well for the last 10-11 years and in a very self-sustaining basis. So it's more of a research university which contributes a lot of trainings and a lot of data, so that we can really guide the healthcare functionaries how actually we can take public health actions, not only the medical related things but also the public health related things. For example, last year they have trained a lot of people on CPR, let's say, such kind of things, like understanding vaccine hesitancy, why vaccine hesitancy is there, how can we actually address the root causes of vaccine hesitancy, how can we remove that one. Similarly, how can we actually improve the more positive behavioral healthcare intervention. So like that, it basically, the idea of university is that it can actually it can in fact build a very good workforce. That is, in fact, it also can help the state government in terms of public health trainings, so that our response to healthcare, like in situations like COVID, our response would be much stronger and much better.
Definitely, I think with God's grace, we could start the Shillong Medical College. Yes. That also be inspired, and then most of the faculty we have used the in-service doctor we have to bring. And at the same time, we realized the importance that right now we need to have a medical college. So I think all these things right now we are facing. If there was a medical college, I'm not here to blame anyone or point finger to anybody, but I think if the medical college would have been there 10 years ago, then I think the situation would have been different. So, but like you already have seen yourself, that I think thanks under the able leadership of our honorable chief minister, as you can see today, that we have already start the first batch of the Shillong Medical College, 15 numbers of them, and then even the Perno Sangma. This international medical college. From there also we'll get many numbers of doctors, and hopefully that everything goes well, that by next session Tura Medical College will come up, so we'll get quite a number of doctors. So I think in the coming years we'll be able to solve the shortage of doctors.